Hi, guys. Welcome to another episode of Dharma Talk. I am Rabia, a psychotherapist in Houston, Texas, and an energy healer as well, as weird as that sounds. The word Dharma can mean many things. It can be our purpose, it can be right action, it can be doing the right thing. So I created Dharma Talk so that I can share with you right and true information that I've had the privilege to learn over the years through education, access, opportunity, and then my own life experiences. My intention is always to be of service to you in the highest way that I can, to illuminate and enlighten you. And I say this not with arrogance, but with the belief that when we know better, we do better. We make better choices, and better choices, however small, lead to a better life. And a better life leads to more joy. And when we're joyful and thriving in our lives, we treat others and ourselves with greater kindness, compassion, and empathy. I wanted to do today's show specifically on infertility and IVF, even miscarriages, surrogacy, freezing eggs, like genetic testing. There's so much that goes into the way many of us become mothers now or build a family now. And I shared with you guys last week my own personal journey with infertility and miscarriage and the emotional effects, especially fear and stress. And with what science has to offer now, navigating the world of IVF, building a family in a scientific way or by choice, has just become so broad, and the science changes so fast that we just often don't know what to do with what's out there. And we also don't always know that there are options to Western medicine, and that or we can supplement Western medicine with integrative and Eastern medicine. And sometimes those areas help us perhaps get some answers that we may not be able to get through standard testing. The other thing I wanted to bring up is something that I'm hearing a lot in my office, and that's regarding the vaccine and its effects on fertility. It seemed like before COVID, vaccines were not an issue. And we didn't really think about, getting our kids vaxxed or ourselves vaxxed. And the political climate has changed everything. And so I want to talk to a couple of experts. I see women, probably the biggest reason I wanted to do this today, outside of just sharing with you different things that are out there, is that I have women who come to me in my office that struggle with infertility or building a family, and they experience a lot of self-esteem and self-worth when their bodies can't do what it seems like all other women's bodies can do, which is give birth. And many of us go through the pain in secret because we feel ashamed or defective or broken. And in talking about it and sharing our experiences, we can truly benefit from the support of others, especially other women. And we can see that we have nothing to be ashamed of, and that we're more than our wombs. The two guests that I have today have invaluable information on women's bodies, infertility, IVF, not just from a Western medicine sense, but also from an integrative and an Eastern medicine sense. So first, I've invited Dr. Monica Roberson, and for some of you may remember her from the Women in Wellness episode I did a few months back. Monica is a board certified gynecologist who practices integrative gynecology at the Healing Space Integrative Medicine Center in Houston. She went to UT Medical School in San Antonio for both medicine and OB-GYN residency. And then later, she completed the Andrew Weil Center for Integrative Medicine Fellowship at the University of Arizona. Her practice focuses on treating the whole person, both with traditional medicine and evidence-based natural modalities. Monica, and I know this, is passionate about knowing her patients and understanding how their lifestyles influence their health. And in keeping with this mindset, she really strives to help each person find their own individual wellness by seeking a more balanced lifestyle. And there's so much more I can say about Monica, but I do know that one of her goals is to bring more joy into her patients' daily journeys. She also teaches fellowship students at the Andrew Weil Center for Integrative Medicine. So I know that's a lot, but wait till you hear Dr. Sadhna Singh's bio as well. I met Sudna when I was going through my own journey. Sudna graduated from medical college in India in 1983 and has practiced medicine for over 10 years in the fields of obstetrics, gynecology, and internal medicine. And she completed her master's in acupuncture and oriental medicine in Houston. Sedna holds a doctorate in acupuncture and oriental medicine with an emphasis in women's health from the American College of Traditional Chinese Medicine in San Francisco. Sedna is also one of the few doctor of acupuncture and oriental medicine in a newly accredited advanced doctorate degree for a licensed acupuncturist. So she can answer this better. I think there are like 60, 70 people that are actually doctors in Chinese medicine. And then with Sedna's background in both Western and Eastern medicine and her compassion and concern for patients, she's dedicated to really providing effective, comprehensive, and exceptional care. There's much, much more I can say about this, about both of these women and their gift to me in my life, and also their gift to other women that that have seen them, that we find out through just talking, that, oh, you went here, I went here. So having said all that, I'd really like to welcome my two guests, Monica and Sedna.
Hello.
Hi.
Thank you, Rabia, for your words.
Thank you so much for coming because, again, it's late at night or evening and y'all have families and so much to do. And so I welcome you guys for taking the time out, and then also for all of you watching. So I appreciate your being here. What I'd like to start off with is, there seems to be an increase in fertility issues. And I don't know if I'm imagining that, or, are women just waiting longer to have kids, or what in y'all's experience seems to be happening with this shift? Either. Sadhna, I know you work a lot with infertility patients. So what do you see sort of happening?
Rabia, it's a combination of a lot of different factors. As you rightly pointed out, there's definitely that women are, and rightly so, involved in, specializing in their fields, working on progressing their careers in different ways. So there is a little bit of a delay there. Nobody's trying to get pregnant from 20 to 25 when it's like, highest on fertility. So there is a
You
delay.
blink and you get pregnant.
Sorry?
You blink and get pregnant.
Exactly. And so there is that delay. There is a lot of changes in our diet. There's a lot of changes on one of the major things being stress levels, because we just, for example, just the pandemic, just the stress that we are going through on a daily, day-to-day life, that is affecting to a certain extent how the hormonal imbalance can be set off. So number of different factors. We talked about how delays, age, whether them being on a longer time on the birth control pill, if that has any impact at all, or if there is not so much a direct impact as would be more about masking of symptoms. Because, say, for example, somebody has irregular periods and their underlying cause could be polycystic ovarian syndrome, so PCOS. And if they get put on the pill, they are having a period every month. So they have that false sense of like we fine, versus somebody who was not having a period for 3-4 months, and then they would seek help of a gynecologist like Dr. Monica to say, what do we do? How can we manage this in a different way? So I think it masks sometimes, not so much being on the pill that is a cause for the infertility, but getting some earlier diagnosis. Um, and as I mentioned, the food, the preservatives, these chemicals. We know there's a bunch of chemicals that has a detrimental effect on fertility. So there are numerous causes, and then we don't want to just be bogged down by those. And just the women, is the men have equally sort of in that process.
Yeah, and I know today we're focusing a lot on the female side of it. I see more of that than the male side of it. So Monica, kind of going on some of what Sedna is sharing about the chemicals and the preservatives, and then knowing so much about the integrative aspect, which is like that whole body wellness, which I'm assuming affects our ability to conceive as well.
For sure. For sure. I mean, I think we're still in our infancy and really understanding how the chemicals that are around us impact our hormones. But there's no question, there's lots of evidence coming out saying that there are lots of hormonal disruptors all around us, especially from the plastics that we take in all the time. I understand there's studies where they've looked at the number of chemicals in pregnant women's blood, and it's super, super high. Wow. So I think we're all exposed to lots of chemicals constantly, and I don't think we really understand exactly what that means, but I'm certain it's playing a role in fertility. We also have an increased amount of polycystic ovarian syndrome right now, and that has a lot to do with probably what you just mentioned, the chemicals, but also a lot to do with our lifestyles and our sedentary lifestyles, and just the amount of the larger amount of overweightness that we have in our country right now, and that definitely can feed into polycystic ovarian syndrome, as can other factors such as family history of diabetes.
So in PCOS, I guess polycystic, can you explain a little bit what that is?
Yes. So for some women, we don't understand exactly why, but for some women, they don't have regular periods, and insulin resistance and prediabetes can play a role with this. And cause the testosterone levels to be relatively higher than normal, and all of this just prevents ovulation from happening.
Oh, okay.
And so
Okay.
that's actually one type of infertility that can be remedied pretty well with our natural approaches. And so we have good evidence that for those women who are overweight and have PCOS, losing 5% of their body mass can
Okay.
actually lead to ovulation.
Mm-hmm.
And then we know that exercise also can play a role, and there's some natural supplements that can help with that also.
And I want to circle back to what some of those supplements may be as we get more into this. Sedna, I appreciate what you said about being, if we're delaying a lot of things and maybe getting married later, or even deciding to have kids later, and we've been on the pill, for 15 years or so, and that how that may mask underlying conditions, because it sort of regulates our hormones. And then without the pill, we find out like, oh crap, I didn't know this. And I'm just wondering for the young women out there, how they can, what kind of tests they should get, even if, I guess they're taking birth control. Like, are there things that they could check on their annual visits?
Well, I strongly feel about the fact, and this is just me, about the AMH, which is the anti-Mullerian hormone, which talks about our ovarian reserve.
Mm-hmm.
Sometimes it only gets checked at age 38 or 39 when there's been difficulty in conceiving. And to a certain extent, if we even check that in younger women
Mm-hmm.
who are not actively trying to conceive, we may have some baseline as to, okay, do we have an alert here? Do we need to do something ahead of time? And the beauty with a lot of the reproductive medicine advances is that I share that with almost everybody. And I've come to be one of those, maybe even on a plane, like if I'm sitting next to a young lady who's talking about something about relationships, or I come to know that she's 35 and above, and I do introduce the fact that you could do some egg freezing.
Mm-hmm.
It's because we're born with a certain number of eggs which only deplete over a course of time, and that's our main concern, is about how age has an impact and how can we preserve this whole fertility in a better way. So a little bit of a long-winded answer there to you, what you were alluding to, Rabia, but it's like maybe doing some diagnostics really early on, especially if there are red flags about the fact that in their adolescent teen ages that they've had to be put on a birth control pill because of heavy periods, because of irregular cycles.
Yeah.
And those who choose to get married later, whether it's something about their planning or how they want to do, then may as well look at preservation, because it's always nice to have that information and be at 35 and before 35 preserved. And whenever you look at that fertility at a later point, at least you have that option as the optimal sort of functioning.
I 100% agree that now that we do have the science of freezing our eggs, at earlier ages when they're stronger, fresher, I don't know, whatever the term is.
Better.
Okay. That, it concerns me that those procedures are so expensive. And I talked about this last week, that I really hope we can get better at creating opportunities for people that don't have the kind of funds that may be needed, or maybe if insurance companies start picking that up. I don't know. I don't know the solution. Monica, what do you sort of advise your patients how long should they try? When should they go see a fertility specialist or a reproductive specialist?
A lot of it really depends on their ages, more than anything. So if I have a 27-year-old who has gone 1 year without a period, that's typically the time that we would recommend is going 1 year without conceiving. And then if the person's not pregnant, then to go see the reproductive endocrinologist.
Okay.
But, some people at that point, if they're 27, may want to spend a little more time and try natural ways a little bit longer. I think they have obviously a lot more space to do that, more time to do that than if, say, on the other hand, someone's 35 or 37, because their window is a lot more narrow. And so I think if a woman's older, she may want to, maybe not wait the full year if she's 35, maybe 7-8 months is enough time.
Yeah.
Depending on how large of a family that she wants to have.
And how does some of the, early things that many women go through, and I hear this in my office, like, oh, I've had an abortion when I was younger, or I've had STIs or sexually transmitted infections. How likely are those things to affect a woman's ability to conceive or even retain a pregnancy?
So definitely abortions are quite unlikely to cause issues. They can if a woman's had multiple abortions, but that's unlikely to be an issue. Sexually transmitted diseases, depending on which one and how severe the infection was, are more likely than an abortion. But even that is still much less likely to cause it than most people think. So,
okay,
the one that would be the most problematic is if a woman's had pelvic inflammatory disease, and so this is a pretty severe situation, generally speaking. She will have had a fever, and it will have been a pretty major infection. That definitely can put a woman at a little higher risk. But even with that, we're talking 12% chance of infertility, not just one episode of that. 12% chances of infertility, not 50 or 75%.
Right. So it seems like a lot of it is environmental, and then the age of the woman, and health, lifestyle. I remember, so I was 40 when I started getting all my checks, because that's when I met the right person. And on the what is it that I can't ever get the name right? HSP, or when they inject the saline and they do the ultrasound
angiogram, the HSP.
Yeah, that one. It's a mouthful. And I had a septum in my uterus. And only when they went in to remove the septum did they see that, I had stage 4 plus endometriosis. And though I think the symptoms of my endometriosis may have been covered up by being on the pill, for so long, because it helped my periods, and it just helped, me suffer a little bit less. Things like fibroids, because I also hear that. And I'm wondering if there are other options with fibroids, or how much fibroids can interfere. Maybe that has more to do with carrying to term, or I don't know.
Yeah, fibroids are kind of a complicated thing because it depends on the location and the size of the fibroid. I mean, fibroids are super common. By the time a woman's 40, about 40% of us have a fibroid, so they're super, super common. So in and of itself, a fibroid's most likely not to be a big deal. But if they're of sufficient size and the wrong location, they can be a problem, certainly.
And the integrative or traditional Chinese methods, how do those work with things like fibroids? or does it have to go with surgery?
Well, it's variable. And again, as Monica pointed out, it's more important about the size, the location. But say if we have, at times they respond well to the acupuncture and the herbs, and they have to be a certain size or a certain, limited amount. Like there's not like you can have a huge grapefruit size fibroid that you're going to shrink anyway with anything, in terms of acupuncture or herbal treatments and formulations, and some will be requiring surgery. But that's where it becomes very important to work in a very sort of a complementary way with their medical personnel, because then you get a better picture. You're able to talk to the patient's gynecologist or reproductive endocrinologist, say this is what is keeping things from happening for now. What are the solutions here? If they're not ready for surgery right away, we could help with working on trying to work on shrinking it. But it's a very large one. We're not going to get it totally out of the uterus, so they would still require surgery. So in some ways, it can help to have this integrative sort of working with their Western medicine doctor. That way, they can give you a good guidance for us as practitioners of acupuncture and herbal medicine. And to some of them react well to the herbs and acupuncture, and we've had some success, and some of them do not and will require surgery, in which case we can still sort of assist the process by faster healing, better healing, lesser adhesions, getting, as we call in lay terms, is getting the blood and the chi moving better, prepping as well as helping healing later.
I see.
As Monica was earlier saying, of course, the referrals and how long you want them to wait before they getting treatment wise, very rightly so on the age. But at the same time, as you all were talking about the pelvic inflammatory disease, say somebody, it's a good history taking is very important in our patients. We have a very comprehensive history taking process. And if we talk to somebody who's been trying pretty regularly for about 2 years, and they have this huge infection they'd had when they were age 19 or 20, and there's been no checks, and that's when, as a practitioner of complementary medicine, that we would reach out to our Western medicine counterparts and say, okay, this she needs to have an HSG or a hysterosalpingogram or even a hysteroscopy to take a look at the uterus. If something is, as Rabia, you pointed out, whether there's a septum or anything that could be getting in the way. So it's very individual in terms of, each individual patient, and across the board, it's kind of hard to completely say it would or wouldn't, but work along with it. Yeah.
Right. I know that, when I was first going through the whole process, I had asked my IVF doctor, like, okay, so while I'm waiting to ovulate, or how do I reduce the cyst? What else can I do? And this is 2006. And she had said, well, I heard that acupuncture works for some people, but that may be placebo. And I think, Sadhna, I came into your office and I said that to you, and you said something about, well, it seems to help bulls' fertility or something, that they use it on animals, and so that can't really be placebo. But now the Western doctors seem to be more knowledgeable about complementary healing methodologies.
Yeah, I definitely have seen that shift. As you mentioned, what you were, talking about with 16 years ago, things have changed. And to give you an example, even with ASRM, which is called the American Society of Reproductive Medicine, if you go on their website and type in acupuncture, there's a fact sheet for patients. So I think, that in itself talks about how we have come a long way, and in a positive fashion, to be able to incorporate both, to be able, there is limitations on both. There is things that we could work collectively in a very positive way for our patients. So that ASRM fact sheet actually tells patients about when they should start acupuncture 3 months ahead of time. And this is ASRM giving them information. And even if it says it reduces stress, because that is something that they've been tangibly able to measure, as well as improves implantation rates in an IVF transfer. The very fact that they're putting it out there, that, like I said, is really tells a lot about how they're ready to integrate. And a lot of the specialists, I would say majority of them nowadays, would refer their patients out to acupuncturists. And so that's been really a wonderful change, a wonderful shift.
Yeah. I think I had one of your acupuncturists do acupuncture on my surrogate, during her egg retrieval or
The transfer.
the transfer. So I at that, and that seemed by then like, why wouldn't, it be sort of included with the whole process, if for no other reason than to reduce, the incredible amount of stress and fear that goes with that, going through those things. Monica, what are some of the, I guess, supplemental ways we can maybe affect our health overall, like our overall wellness, which can lead to better outcomes with getting pregnant, staying pregnant, that kind of stuff?
Well, first and foremost, I just want to say one that's, I'm sure, very obvious to everybody, but I think a lot of people forget. Prenatal vitamin is absolutely essential when there's even a thought that a pregnancy may be in one's future. So you want to be on a prenatal vitamin at least 1 month before trying to conceive. I just want to put that out there because it's such an important thing, because the folic acid in the vitamin prevents neural tube defects. And so that's just such an important, simple thing that is just very, very, very important to know. So there's that. But I would say get back to the basics of the things that seem so obvious, but in our busy world where everyone's running endlessly, right? We forget to make sure you're sleeping, make sure you're getting 7 to 8 hours of sleep every night, make sure you're staying active and getting at least bare minimum 2.5 hours of exercise per week, and focusing on a plant forward diet where you're getting all the colors of the rainbow daily, and having lean, healthy proteins, lots of beans, all of that. And definitely when one's trying to conceive, yes, you can have fish, but probably no more than twice per week. Those are the current guidelines, just because the level of mercury in so many of the fish
could harm or get in the way.
Yes.
Yeah.
Yes. So the EPA recommends no more than twice a week with fish, and there's 5 fish that they say to avoid when you're trying to conceive or when you're pregnant.
Oh, that would be great to know what those 5 are.
Yes, tilefish. Who eats that? But king mackerel, shark, swordfish, and the one that people eat, tuna. So.
Okay. So salmon, which our family does a lot of, is safer?
Excellent. Yes, that's great. Great choice.
Okay. The other thing that the last couple of years, or maybe the last 18 months, has brought up is COVID vaccines and fertility and how they may interact. So I'm curious what each of you thinks about that.
Well, I'll just start with this. I want to put two things out there. First of all, we just had a study looking at, or really it was a survey, looking at women who had just had the vaccine. There were some irregularities with their periods right after the vaccine, but then everything returned to normal. So I want to say this, that, like, women have been heard. Yes, we recognize there are some abnormalities right after you have the vaccine, but this is nothing that should be long term. It should not in any way, form, or fashion impact fertility, because, in all reality, the vaccine actually leaves your system within 3 days of having it. So there's nothing about the vaccine that would stay in your system. I think people get nervous when they hear messenger RNA and this with DNA, but there's no connection. I've heard it put this way, and I think it's a great way of saying it. DNA becomes messenger RNA, but messenger RNA can never become DNA. So it cannot ever impact what's hidden inside the nucleus of all of our cells. So.
See, that's something I wouldn't have known, because we hear a lot about mRNA, and oh my God, you don't know what you're putting into your body.
Right. But no, and we have good studies now, good evidence that the vaccine is not only protecting mom when she's pregnant, but also maybe protecting the baby once the baby arrives, just because she's potentially passing on her own antibodies to the baby. And then, the other thing is, I just don't think we talk enough about this, but pregnancy itself is such a, I'm going to say, challenging time on a woman's body. And so definitely pregnant women are at much higher risk for getting very, very ill with COVID, much higher risk than a woman who's of the same age and not pregnant. So it's probably more important than any other time in life, except maybe elderly, to get the vaccine. So I definitely would recommend it.
Yes, I have exactly the same sentiment about the vaccine, and would like to share how, again, the data, and we have a whole year of data on the vaccine. We have, that's about, as the statistics go, about like 4 billion people worldwide who've been vaccinated. As Monica pointed out, the mRNA, the messenger RNA in the vaccine, it just stays in the cytoplasm of that deltoid muscle. It's just giving a message to the body to get antibodies made. Now, this vaccine does not cross the placental barrier or gets across to the placenta. But as you also alluded to the fact that, Monica, the antibodies have been seen to provide good antibody, help to the baby, because those can cross over. And currently, what we are facing is more a pandemic of the unvaccinated. So we really have I think, a huge civic duty in promoting the vaccination.
Yes.
The negative effects, the negative long-term effects, and especially with our pregnant patients, can totally outweigh the minor sort of side effects you feel, if any, with the vaccine. And it's transient for that period to change. And if you hear from social media about someone's period changing, that should be no reason for you to not take the vaccine. I think totally go, check in with the medical specialist, the doctor who's seeing you. This is based on science. It's based on data that we have showing that the long term. Now, we also have all over the country long-term COVID clinics, because we've got patients who have long-term pulmonary issues, or I see a patient who has tachycardia as a result, and she is an ICU physician herself. So she's not left any stone unturned about why this cardiac situation is happening, but there is no explanation on the medicine for why it's happening, but it's a long-term effect of the COVID. There's nothing that can sort of find out why. So given that, and given the complications that can happen in pregnant patients, it behooves them to really either take the vaccine before they even start to conceive, during pregnancy, to provide themselves and the fetus better, protection against COVID.
Yes.
I actually had a client the other day who got COVID and is now having long COVID, and the brain fog is still there. And she's having something called COVID tongue, where her tongue is more swollen. And so she's biting it a lot at night. But I mean, there's so much that happens. And so I don't want to just focus on that, but I do want to stress the safety of the vaccine for pregnancy and fertility.
Right. And with no negative impact on it.
Yes. Yeah. In fact,
and lots of positives.
Lots of positives.
Protecting the baby more than anything. Just think of this.
Yeah.
Protecting the baby, protecting mom while she's pregnant, so that she doesn't end up in the ICU and potentially really, cause harm to the baby from the illness.
Right.
Yes.
Totally.
Yeah. There's a comment here. Long COVID is a deactivation of Epstein-Barr. Maybe we need to talk to an epidemiologist. I don't even know what Epstein-Barr is. So, and how, reactivation of Epstein-Barr. So someone may already have it. Yes. Okay.
There's likely many causes right now. They're thinking of long COVID, and so it's really multifactorial. So I think it's hard to we don't know exactly what the reason is, and reasons are. It's a better way of putting it.
Yeah.
But it's definitely with talking about as Rabia, you are focusing on this subject of fertility today, is even providing that platform for people to be able to feel comfortable to discuss about it, to talk about it, to share. You sharing your story is a great way to, put it out there that there is nothing to be to hide about it or to stress on your own about it. And we see so many support groups for women, whether it's fertility, whether it's miscarriage. Today itself, I was listening into the radio this morning to work, and on BBC they were talking about this podcast for men. It's called Dads Still Standing. So I haven't heard it as yet because I just heard the mention, but also like to support both men and women. But of course, the majority of our practice, as well as I think Monica, you see mostly women. So it's like this is a great way to kind of encourage them. It takes a village to raise a child, but it takes a village to also get that fertility journey on a smooth path with combining, as Monica said, supplements, as you said, the psychological aspect, as acupuncture and herbal remedies can be helpful too. So it's sort of a complete holistic approach.
The IVF journey for most people, it's such a roller coaster because we can't really predict. It depends on when you ovulate, and there are like all these other little moving pieces that we don't even think about. And so it's so stressful. And I remember, Sedna, I don't know how many times a week I saw you, but it was helpful also with my stress, because the whole process of acupuncture was so relaxing, even though we think that needles in your body wouldn't be, but that was not my experience. I remember that was the only time I kind of got to take a nap, was during the treatment. And the psychological side of it, the stress side of it is profound. And that's what I do also. So I do get to see the anxiety and the fear over what if I can't, or what if it doesn't work, or this is our third attempt, and everything. There's so much pressure that we put, and then secrecy doesn't help the pressure, so I'm hoping anyone watching can know that there are villages out there to help, and we really do work well as a community. You know, it took two other women to help me become a mother. My sister who donated the eggs, and then the gestational carrier who carried the embryo. And so uh, there are no words to express my gratitude for a village, you know, helping me. Um, and so, sorry, I'm slightly off topic here, but um, what kinds of supplements or herbs are sort of um, women's wellness type things that, even if maybe we're not shooting for getting pregnant, but we want like a healthy uterus and system to stay pregnant, or just to be healthy overall?
I'll start by answering about the herbs, and I'll leave the supplement portion to Monica. With with herbs, what happens is, Rabia, it's very individualized about how we are going to formulate it. But at the same time, because in our clinic we have powders and we have a capsule making machine, and we can put them together, say for one particular patient, besides their overall wellness, they are having some sleep issues, then we can add some herbs that will assist those. Or if they're having some digestion concerns, we can add some herbs to the mix to help that till that digestion concern is better, and then we can modify once again. But overall, to put it in simpler way would be, say for example, somebody is where we call advanced maternal age, or they've been having difficulty, a lot of times there could be some nourishing required, so they eat that, but not across the board for everybody. So some may require more nourishing. Some who've had numerous cycles on one of the medications for helping ovulation is Clomid or Letrozole, and have had numerous on those, we may start with a liver detox. We may want to balance their system before we do anything further on nourishing. So to answer your question on that, it would be more about each individual patient as to what underlying pattern on a traditional herbal diagnostics that we are seeing to assist them balance things better.
Yes.
So there are numerous herbs that can help with that, as well as, of course, the acupuncture, and then a lot of supplements. And I'm sure Monica has some that she would like to share with us on that.
Yes, I would just say, I mean, I'd say just in general, when a woman's trying to conceive, I wouldn't recommend many supplements at that point in time. Definitely the prenatal vitamin, like we talked about, and then an omega-3, I think is always good, just because of the essential fats that are found in those. But definitely you can get omega-3s from eating fish too.
Yes.
But I'm not a big fan of recommending too many supplements, just because there's so many questions about the different companies, the different brands. And I would make certain, even with your prenatal vitamin, make sure it's a good, high quality brand. And definitely with the fish oil too, you take that.
I find a lot of times even antioxidants is a good sort of an add-on. So maybe to a certain extent, like ubiquinol, which is an coenzyme Q10, an antioxidant on a cellular level that's going to improve that each cell on its potential. And that's exactly what we talk about when we say with traditional Chinese medicine, is we are improving the qi. The qi is energy that we are channeling, whether it's in the form of food or supplements, but we're introducing or supplementing that, because over the period of time, our chi or energy starts to decline. And a lot of that decline on it is impacted by lifestyle. So that's where Monica had pointed out about, having not so much of a sedentary lifestyle, or watching what you eat, because all of these are if they're not followed in the right fashion, then you're not supplementing that chi that you're losing over time.
I see.
And you lose more if you are working 20 hours a day, if you're
Yeah.
not sleeping
Yeah.
7 to 8 hours. So you're expending. It's the same as exercise. You're balancing when you take your certain calorie intake and you expend calories, but on a chi depletion and not supplementing. So one of the commonly given supplements that I see with a lot of reproductive endocrinologists is also about the antioxidants. So that's something in addition to the prenatal vitamins.
And so if Mike, I know you and I talked about this briefly, like how would one even pick out the right prenatal vitamin? Like what do we order online? Do we go to you, the doc, like maybe Western medicine? Like how do we even know what we're taking?
Yeah, well, I think definitely each person can talk to their OB, and the OB can definitely give them a prescription for a prenatal vitamin, and you can trust that one for sure. There's brands that definitely you can trust. You want to look for something that's third party tested, so we know that it's clean and it contains what it claims to contain. And so one place you could look for that is consumerlab.com. It's really, it's a neat website that analyzes different supplements to make sure they're clean, like we talked about. And then you can also look at the bottle and see if it says GMP, and that's another version of third-party tested.
Oh, okay, good.
Yeah, that's what, in fact, with the herbs we have, they are not FDA approved because herbs are not, but they're GMP or the good manufacturing process. And oftentimes when I'm asked by patients about which prenatals or what do I recommend, I always tell them, please ask a doctor. You go in for either your primary care or your gynecologist. I'm sure they'll give you the best that is out there in the market or suggestion for that.
And so when I was going through all of this, I and I know I'm not alone, but there can be such a desperation to get this to work, to have our bodies work and all of that. And I remember at the time there was a lot of talk in some of the chats, I guess, that if you stand near a microwave, it can affect your fertility. Or now everyone's got their Bluetooth, it's cell phone stuff, and the type of water you drink. And so I'm just curious, from each of your perspectives, is that legitimate fears that we should look into, or are they a way of sort of controlling something that we may not really be able to control? So microwaves, no answer.
I mean, from hearing all about or reading about the different impacts that microwaving can have on the food, we all do it. I mean, I use it all the time, but it's one of those that where you can avoid it. Maybe something to avoid, but as you mentioned about the stress, my main concern is to not stress them further.
That's what I think. So
a lot of times I'm like, do whatever you need to do in moderation. Say where you can heat it on the stove, do it that way. For water, as long as you hydrate well, because that's another challenge with patients, like they are not hydrating as much, and even these days more so because those who have masks on all the time, or there's all that. So when they ask the question about the water, it's like let a lot of times it's like about them doing their own research and saying, I came up with this and this is what I would do. It's like, if that is something you want to do, make sure you have enough of it. More about hydration, more about cutting back what you can. And another thing is, in conjunction with their in vitro fertilization treatments or frozen embryo transfers. Sometimes they're in a panic and come in to see us like a week before because they heard from a friend and that acupuncture can help. And then they have all these questions about what can I change diet? What can I change about supplements? And then the answer is don't change anything, because if we have the time, as you have or 2 or 3 months ahead of time, then that's when one can take a little count of what are they putting into their body. With that last week, it's just like you'd rather not want them stressed
Yes.
than really trying to run to get a certain type of water, a certain supplement.
Yes. Yes.
So all of these, there is a certain element of like some facts there that could work, could be harmful there. But there again, like seeing an individual who specializes in either the nutrition part of it,
Mhm.
or like a more wellness background, or somebody who is doing functional medicine, somebody who's an expert in their field. Um, I'm not listening to or getting your news from the social media or the blogs. That is,
Yeah.
the medical personnel are there for to guide you better.
Yeah.
I would fall back on that.
And then as far as genetic testing on embryos, now, we can pick genders, we can there's so much medicine can do. What, if any, recommendations maybe? And I don't want to pigeonhole you into like yes or no, get it done or not get it done, because I think it's a choice. But what is, generally, is it safe for the embryos to go through genetic testing?
It's the genetic testing again, if recommended by their specialist, because it's just out there, it doesn't mean everybody needs to do it.
Mm.
What we see with patients is those who have had a history of numerous miscarriages, those who are of an age where the concerns are about, as our bodies, as we get older, we make our genetic system makes more mistakes in the whole dividing, fertilizing. So that's why there's a higher incidence of miscarriages at times with some women who are older than 40. Not to say that everybody will miscarry if they're past 40, but there's a higher risk. So in individuals where there is a lot of unexplained miscarriages, or challenges, or even some familial genetically passed on diseases in which they want to make sure that their offspring doesn't carry that genetic. So so the choice, like you said, is theirs, but at the same time under guidance by a geneticist or the reproductive endocrinologist.
Yes.
And it's nothing is 100%, so I would say it's a 98, 99% safe for the embryo,
Okay.
because they're not even actually taking cells from the embryo, but the outer trochoectoderm, that is the cells outside, because those reflect what's going on inside. And that's what happens sometimes, that there are errors on these tests also, because the body has a great ability to self-correct. Some of the
Yeah.
what we call mosaicism, where the chromosomes may not show up as how they want the division, but that could self-correct at certain times. So in some of our patients, we see if the genetically tested embryos have not worked, say on a repeated 2 or 3 frozen embryo transfers, and they take a step back and they are like, maybe we don't want to test this lot.
Yeah.
That might work. So it's a relatively safe, it's safe for the embryo, but there again, just getting each individual according to what it's the specialist will give them the right recommendation and the pros and cons.
Okay. So there's good information out there and good evidence-based science. And the best thing is just to educate, research, and ask the questions.
Exactly. Yeah.
So I see that we're at an hour and it went by like this. And I know there's so much more. So I have a feeling that we're going to be coming back to this conversation on another episode. Monica and Sadhna, I really quickly, what is something that maybe someone who cannot afford to do all of the tests and all of the processes, I'm hearing that maybe just having a lifestyle that is overall healthy, balanced, and maybe incorporating things that bring us some kind of peace on an unpeaceful journey often, like yoga and meditation and Tai Chi and Qigong. Like there are the ancient things that are out there that we can do for free. That can, anyway,
Yes.
I know we're out of time. So I do want to thank you both for taking time out and sharing your wisdom with us. And I know that there are the links to your websites on the banner here, and that this video is going to be available on YouTube and Facebook as well. And so whoever doesn't get it live can watch the recordings and share the recordings with other people that might need it. I do want to say in closing is that that none of us does this alone. This is a village, and it's a human village. And when we think of ourselves as broken or unfixable or damaged, we're not giving ourselves enough credit, because we are more than that. We're more than our bodies. We are spirits and emotions and hearts. And I want you to know that you matter. Your feelings matter, your wishes matter, your voice matters, and that you're already a miracle for being here. So having said that, I want to thank you guys again. Thank you, ladies, again, for what you do and for how you help me in my own journey and your caring about the whole person. I really appreciate that.